Hi, future nurses. My name is Sadie Farnsworth. I'm so excited to be done with this program and get started and get practicing. I just accepted a position part-time at a high acuity rehab facility that's about 15 minutes from my house. I'm super excited for the experience because it sounds like I will be able to practice all of my skills and get a ton of experience. So that's the plan for the next couple years. For my presentation, we're going to talk about providing safe and quality care for patients as the nurse. The Quality and Safety Education for Nurses provides an outline for quality care while practicing safely. Areas that I will focus on today are communication and teamwork, family and patient-centered care, evidence-based practice, quality improvement, informatics, and patient safety. Communication and teamwork. I've noticed so many different dynamics in different units that I've worked at in the hospitals. It's super frustrating to be the student and to see how the experienced nurses treat us sometimes. Sometimes we don't get the warmest welcome, and it's hard to deal with the more experienced nurses. So what I've found is being a good communicator really helps in that situation. It's important to offer to help, offer or ask their opinions, because that shows that you want to learn from them. It's a two-way relationship. I found that assisting other nurses in my capstone was super beneficial because they would always come for me for procedures and let me do everything. They knew that I would ask questions and I would try to learn as much as possible. It was nice because most of my situations were one-on-one patients, and being able to see 3 or 4 patients during a shift was super cool because everything was such a high acuity. I did my capstone at Primary Children, so I was in the PICU a lot, the NICU, and mostly the cancer unit. So it was really cool to see all the different experiences, and for the other nurses as well as my preceptor to understand that I was there to help. They asked for help a lot, which was cool because again, it gave me more experience. And it also provides this mutual support that they know, the patient knows that everyone is willing to help them. In situations like this, I feel like leaders develop. You get leadership roles because of the opportunities to communicate and the teamwork, and it really provides a positive work experience and a positive work environment for the entire unit. Patient and family-centered care. It's important as a nurse to focus on the whole situation. Most of the time, the families, the patient, they have just been through a traumatic experience or something awful, so a lot of the times they're really grumpy. As the nurse, it's important to provide for your patient's needs as well as the family's needs. Being able to do that, it's kind of easy because we just have to be good communicators. If we're educating the patient and the family about all the processes and the experiences that we expect and that they're having, then it opens the door for good communication. It's important to understand the cultural differences in families. I've noticed that a lot of the times it's things that I've never experienced. And it's important to just ask. I was super nervous a couple times, but I just asked, what do you prefer? What would you like me to do? In one of the situations I was in a labor and delivery clinical, the mom and her sister were practicing yoga and drinking tea and things like that. And so it was important for us to be quiet and respect their practice. Keep an open mind. This builds a trusting relationship between the families and the nurse, and they understand that you're there to provide quality care. Evidence-based practice. I think as a new nurse, evidence-based practice is kind of overwhelming. We're taught by a preceptor. The things that the preceptor teaches us are how we are supposed to do things. So I think that practicing that way is fine, but once we're on our own without a preceptor, it's important for us to develop our own process. As we develop our own process, we're able to improve it and provide better quality, routine things like assessments that help us practice our own evidence-based practice. In addition, hospitals can use evidence-based practice as well. When I was at Primary Children's, the PICC line team was using a new process for changing the dressing on a PICC line. It was really cool because the entire time the nurse was explaining to me what was happening. they were using glue on the insertion of the PICC line. So when not only were the PICC lines staying in place, but they were having less infection rates in the PICC lines as well. So they were taking all of that data and applying it on a day-to-day basis. It was amazing to see it in actual practice and for the nurses to explain how they were improving this process. I think it's hard, again, to develop our own evidence-based practice as new nurses, but I do believe that using this different types of evidence-based practice results in a better quality patient care and service as a nurse. For quality improvements, I found 6 primary goals that I really liked. It was written by Danielle Gagnon of Southern New Hampshire University, and her 6 goals are, number 1 was safe, and it's just avoiding harm to patients during any of their treatments or any of their cares. Number 2 was being effective, making sure that the patient is benefiting from the process that they're going through, and making sure that we're avoiding anything that could slow down that process and slow down the quality of care that they're receiving. Number 3 was being timely, reducing the wait times and the delays for the treatment. Number 4 was efficient, avoiding the waste of the medical equipment, avoiding your waste of your energy and time, and being very efficient with your practice. Equitable, ensuring the quality of care does not vary depending on the person receiving it. So no discriminating with gender, ethnicity, location, socioeconomical status. And number 6 is patient-centered, respecting the individual patient's values, preferences, making sure that they are valued and involved in all the decisions for their care because it is their care. Some real-world impacts that were mentioned was reduction in the medication-related adverse effects, optimization of sepsis care, decreased number of urinary catheter infections, and reduced hospital admissions. And again, that was by Danielle Gagnon. It was written in 2021, and she's from Southern New Hampshire University. Informatics. Working with charting systems was a struggle for me because I was in the float pool and every unit charted a little bit differently. It was the same program, but it was just different. The requirements were different. So it's important as a new nurse that we're able to manage our time and figure out how the informatics work and using electronic records work very early on because it will help us become more efficient. Having access to the patient's medical records is priceless. Being able to see the patient's history and what happened and why they're there and what medications they need and what their treatment plan is. All those things, having access to those things is priceless, and that helps us be able to provide the care that we need and that we won't miss anything. It also allows us to track trends and changes in the patient's status. As we are charting and updating the vitals and things, that doctors and specialists are able to access those records and get up-to-date current information on their patients, and it helps them make decisions. It also provides great communication between the nurse and the doctors. In a community aspect, we can use the informatics as education for the community. For example, at a health fair, there may be blood pressure screenings, cholesterol screenings, things like that we're able to provide the results through a program. They're able to access their information online, and we're able to educate on those specific needs. Early education can really promote the health of a community and the health of the population. Patient safety. As we all know, the NCLEX is coming up when we're finished. The NCLEX is a safety test. It is testing our ability to keep patients safe, to make the correct decisions, to provide that safety for our patients. It's a pass-fail environment with the NCLEX. One example of practicing safely are the 6 rights of medication administration. It's the right patient, the right medication, the right dose, the right time, the right route, and we're documenting correctly. This allows us to double check, triple check, and make sure that we're giving the patient the correct, or putting the patient in the correct situation. An additional example would be when there's a square painted around the pyxis or wherever you're getting your medication to give the patient. If that square's there, then that's a zone where we don't communicate, we don't ask questions. We just look at our orders and we confirm that we're doing the right thing. That way it helps us not be distracted by the things that are going around us. This also decreases human error. In addition, a just culture is a learning culture that is constantly improving and oriented toward patient safety. That is by Boysen. He wrote that in 2013. In this just culture, nurses aren't punished for their mistakes. They're used as learning opportunities to help prevent them happening again. It also allows for confidence because you're accountable and you understand that you are learning from the situations that you are put in. There's a clear and concise reporting system, so you're able to report any mistakes that are made. And I think this really helps build trust for the nurse and the employer because they understand that we're all looking out for the patient's well-being and that we're all trying to get better even if we make mistakes. In conclusion, I think that I am ready to practice safely in most areas. I think that I will be more confident once I get some more experience providing care for patients. I hope that I have the education that I need to recognize changes in my patients and be able to react quickly and correctly. And again, I'm excited for the experience to learn and grow and be a safe, quality nurse, that my patients will trust me and that I'll be able to have good relationships with my employers. Thank you. Good luck for the rest of the semester.